This is a remote case that I diagnosed kennel cough in a dog, and I want you to see how straightforward the case is. Now, I've deleted all or marked out all of the personal information of the client and the patient so that they remain anonymous. And then I've also established a VCPR with this client previous to the remote diagnosis. But I just want you to take a look at how I do this. And I think the biggest trick for veterinarians, because you're probably already doing this, is the conversion from free telemedicine into paid telemedicine. So just to show you how we do it. So start out, and the owner sends me a message on Sunday. So I leave my telemedicine on during the weekends, but on this specific technology, I can turn it on and off at my leisure. So I've decided to leave it on so clients can get a hold of me, and the owner then sends me a question. So my dog, wheezing, weekend, really bad, acting normal, otherwise, and the owner actually asks a specific question. Is it kennel cough? And they've tell me when the dog was vaccinated. You listen to the dog, and it's very stereotypical for kennel cough. The other thing that we can see in this video, we can see that the dog is ambulating, so otherwise in pretty good shape. I congratulate him on having the dog vaccinated, and then explain vaccines, because a lot of owners think that when the dog is vaccinated, it should never get the disease. Ask him about other medication. He gives me that answer. And then the other thing to pay attention to is we use our telemedicine platform to allow clients to message as well, to reduce stress on the telephones, because most of our clients prefer to communicate via text. And so the front desk can turn that off. And it's the weekend, so nobody's at the front desk. So there's an auto reply message that pops up to let the owner, to avoid any frustration that the owner might have. If the owner would send a message directly to the front desk, he would see that auto prompt. I ask a couple other clinical questions. How long does it last? And then here's a link that I send. I use Veterinary Partner a lot, but just information about kennel cough so that the owner can be informed on the internet when he's searching around. I give him a little bit of information, my own information about kennel cough, and then he responds. Slowing down in the afternoon, and then he wants to know when the prescription will be called in. So a lot of time with remote cases, I can call a prescription in if it's an antibiotic that I can get through the human pharmacy. That's a huge convenience for the owner. You don't have to do that. You could have the owner come by the clinic, but again, it's the weekend, so I don't have anybody in the clinic that could dispense, and this owner would like to start medication. So I can just very easily call it into the human pharmacy. So I ask for some personal information to know how to call it into the pharmacy, and then he wants to know if there's anything he can do to help. I say don't exercise her, and then I give a little bit of information about the disease itself so that he can be educated. And down here at the bottom, in this specific technology, what you do is you see timestamps, and the 2 check marks means it's sent and it's been seen. So this is happening in pretty rapid succession, but it doesn't necessarily have to. So 4:15, 4:16, and he says thank you, and then I'll tell him that I'm going to push the telemedicine exam fee. And this is probably the biggest difficulty in integrating paid telemedicine is the fear of how is the client going to respond when we move them from a free service into a paid service. And in reality, I haven't had a lot of pushback. This client got a lot of value from this. It was the weekend. He was able to reach out to his veterinarian, have a quick conversation. He was able to get a diagnosis and a prescription. And even when clients don't necessarily get a diagnosis, they know that there's a professional fee because the technology has a big banner across the top that says this is going to be a certain amount of money. And I, as the doctor, get to push the fee. So it's not automatically generated, but the expectations are very well laid out. And then lastly, when I close out the consultation, this is what's generated. And that entire conversation then is created into a PDF that then I can drag and drop into my medical software. So the entire history is preserved and pretty straightforward.